Welcome. Joining me today is a young man who has been in the trenches serving the St. Louis community and beyond for the past 15 years as a health commissioner, director of health, and a director of communicable disease, vector, and veterinary programs, chief of communicable diseases for the Illinois Department of Public Health, and physician for the United States Navy. Most recently, Dr. Echols was appointed as Chief Executive Officer of Cure Violence Global, an organization with a mission to reduce violence globally while using disease control and behavior change methods. Please join me in welcoming Dr. Frederick Echols. Welcome. How are you?
I'm doing well. How are you today?
I'm doing great. First of all, I just have to congratulate you on the recent appointment. That is amazing. And not only that, but you have had such an amazing career that has just ranged from being a naval medical officer to the health commissioner for St. Louis City, also the director of health for a time during the pandemic, and you also worked for the state of Illinois in that vein. So tell us, what is your secret to maintaining such a successful career?
Well, a lot of people see where I am right now, but there's a history that comes along with that. So similar to how I tell my staff that it's important to understand the history of health service delivery for indigent populations, it's also important to understand the history of individuals who have achieved certain accomplishments. And so for me, it's really about what happened during my childhood. And so my mother, my grandparents played a pivotal role in making sure that I was grounded, teaching me morals. And I was a Pentecostal individuals as well, and so we were in church all the time. We were in church Wednesday, Friday, Sunday, and even on Saturdays, and then Thursdays there was choir rehearsal, so that we really didn't have a lot of time to engage in a lot of other activities. So we were living a sheltered lifestyle, to having a sheltered childhood really protected us in a lot of ways. And so those morals and those values that I obtained during childhood, I've carried them with me over time. And one thing that my grandfather taught me years ago was, when you know better, you do better.
Right.
And so sometimes what I found is, we have this issue where we'll become content when we get into positions of authority or positions of influence, and sometimes we'll also conform to the system, if you will, and so we'll start to perpetuate those same issues that we're supposed to address. And so really staying true to my calling, which I don't feel is a career, I feel it's a calling on my life to really improve health outcomes for the most vulnerable populations among us, which are typically African Americans and other minorities.
Yes, and you do a great job of that. And I know that you worked during the pandemic, which is like the greatest health crisis of our lifetimes.
Right.
So how did you approach that, and how did you find success in the middle of that?
So one of the things that the military taught me was discipline. And so we were always being focused on the mission and doing whatever we needed to complete the mission. And so at the start of my tenure with the City of St. Louis Department of Health, my focus was to make sure that the organization, all the programs and individuals within the organization understood that we're on the same team. And so if we're on the same team, we have the same mission, we have the same goals, and so we are to work together as one unit to achieve those goals. And so although the health department was severely understaffed, at the start of my tenure, we had roughly 85 staff. And so you have 85 staff that are responsible for implementing probably over 20 programs for a population of 300,000, a little over 300,000 people. You're severely understaffed, and so the infrastructure wasn't really there, but I knew how, from an operations standpoint, how to make it work. And so although we were understaffed, we made significant trends early on, although and up until the last surge of COVID-19 cases, we actually had better outcomes compared to the rest of the region. And so we had a fewer number of deaths. We also had fewer number of cases and a lower case rate than the rest of the region as well. And so I attribute that to the discipline that I obtained during the military, but also the knowledge that I obtained during my time with St. Louis County and the Illinois Department of Public Health. Many people don't know that, but this is my third pandemic. And so I led the Illinois response to the Ebola pandemic, as well as the Zika virus pandemic. And we also had large-scale outbreaks of vaccine-preventable diseases such as measles and mumps
Right.
Across the state during my tenure there as well. And so there's a lot of experience that came with me when I came to the city of St. Louis.
Yes.
And so being able to tap into that reserve of knowledge and those past experiences really helped me get through the pandemic, but also helped me empower my team members all the way to the front line staff and to help us get through those first 3 waves of the pandemic.
That is awesome. And and as you talked about your faith, I thought about how God prepares you.
He does.
Like he'll give you a little crisis, and then it'll be a bigger crisis, and then we had this ultimate crisis, and it also reminds me of, if you're faithful over a few things, he'll make you ruler over many.
That's
so
right.
As I look at your trajectory, from the military through the different health departments, and now you're a part of you're the head of a global organization.
Right.
You see, the promotion was just going from one level to the next.
Right.
So, I figure that you feel very confident in coming into the Cure Violence initiative as well.
Absolutely. One thing that we were taught growing up is that God won't give you anything that you can't handle.
Yeah.
And so he gives you preparation. And so the last several years of my career have really led me to this point where I'm able to go in confidently to lead another organization on a global scale to really help address these critical public health issues.
Right. And as I kind of dovetail back to the pandemic, I know with like you said, a staff of 85, had it grown around that? Was it a little more, or was it 85 people then in 2020?
At that time, there were a few more people that were on staff before then. We had a lot of individuals retire with the chain of administration. But other than that was it. And the issue was not only the number of staff, but also the critical programs had not been developed. So, for example, typically you'll have an emergency preparedness and response team that has leading some of the efforts, such as the incident command structure, making sure that there's streamlined communication regarding critical issues during the pandemic, and that infrastructure wasn't there.
Yeah.
We had prior to the start of my tenure, there was one nurse who was deemed to be the emergency preparedness program.
Oh,
and again,
wow.
that's the emergency preparedness program for an entire city.
Right.
Not sufficient.
300,000.
Right.
Yeah.
And so that was one of the first things that I did, was I established the emergency preparedness program for the City of St. Louis Department of Health. And so during that time, we had 3 individuals leading the program, and they did a phenomenal job helping us with vaccine distribution as well as resource distribution over the course of the pandemic.
Wonderful. And then I'm sure you also partnered with a lot of organizations to, help with testing and vaccinations. Can you speak a little bit more
Absolutely.
to that? Yeah.
So we couldn't do it in a silo.
Yes.
We were already handicapped because we didn't have enough strong workforce. But what we were able to do was partner with individuals in the public and the private sector. We work with the St. Louis Cardinals, the St. Louis Blues, the arts agencies such as Powell Hall, the Fox Theater. A lot of agencies came to the forefront to help out where they could. Wow. And I also want to give a special mention to the federally qualified health centers. So Betty Car People's Health Center, CareSTL Health Center, Affinia Healthcare, and Family Care Health Centers all came to the forefront as well to provide support where they could. And so we were grateful for them creating those additional access points for individuals, especially Black individuals. There was a report that came out, I believe it was in March or April of 2020, and that report said that the first 13 deaths related to COVID-19 were all African American.
I think I do remember
and
that.
So that was really telling for us, and we knew that the African American community was not set up to thrive during the pandemic.
Right.
When we look at with the state of health in the Black community before COVID-19, it was even known about, we were set up to fail. And so we had almost every health condition that you can think of, the African American community was disproportionately affected.
Yes, the disparities, the
Absolutely.
healthcare,
Absolutely.
the high blood pressure, diabetes,
Right.
things like that.
Right.
And I can imagine if you have those pre-existing conditions, getting COVID on top of that makes it even harder.
Right. And the interesting thing is, though, those pre-existing conditions were those conditions that increase individuals' likelihood for having severe outcomes in the event that they were infected with SARS-CoV-2, and that's exactly what we saw.
Yes.
And so one of the things that I also have to, when I talk to my mentors and I talk to my staff, I tell them we have to be unapologetic about prioritizing minorities.
Yeah.
We see that we report on the numbers day in and day out, but if we become content with that, then we're perpetuating the disparity, right? And so by prioritizing minority population, we're able to give them a better trajectory to get through, whether it's the COVID-19 pandemic or the influenza season, successfully.
That is awesome. So really you declared a state of emergency in the minority community that, look, we have to focus and not just accept the status quo.
That's right. And so the interesting thing is that I couldn't verbally say that, but I had to say it with my actions, and that's exactly what I did. And so because when we talk about prioritizing minority populations, it sounds good, but the system doesn't like that. So the system has been set up to disadvantage minority populations or people of color. And so when we started prioritizing minority populations, we would hear from different communities, hey, why are you prioritizing Black people? Other people need these resources. And I'm telling them, hey, there's a whole hospital in West County.
Right.
All right. Whole hospital in West County, lots of physicians, lots of medical providers. When we look at what's happening in North City,
it's
a medical desert. Right. And then even when people access services sometimes in North City, sometimes those services aren't delivered in a culturally sensitive manner. And so they're less likely to actually access those services again because of their previous experience.
And disconnect.
Absolutely. Absolutely. So all of those things we had to manage, but I remained dedicated to making sure that African Americans had access to quality services during the pandemic. And that paid off for us because we saw roughly a 33% reduction in cases over the first few months of the pandemic. And so, I don't take that lightly. And as I said before, I think, being true to my legacy, being true to my calling is something that I'm adamant about.
Right. And, and that was a great job that you all done, because I just watched the whole thing play out, and how, like you said, there was the report that, everybody, those 13 people in St. Louis City passed, they were African American. And then I saw the trajectory where the city started getting better and then the county started getting worse. But there wasn't a amount of publicity that was given to that. Right. But the truth always prevails.
It does.
So, congratulations on that. And so when we look at your current career, so now you're the head of Cure Violence. Give us a little more information about the organization itself.
So Cure Violence Global is an international organization that focuses specifically on violence reduction. And so the mission of the organization is to reduce violence on a global scale using disease control and behavior change methods. And that's really important. So when we look at the strategy or the approach that the organization uses, the first thing is similar to any outbreak or epidemic. What we first do is we detect it. Okay, we know something is going wrong, similar to what happened with COVID-19. Something is not right. This new virus or this new condition was detected in Wuhan, China, is likely to impact us. What do we do? And so detecting these situations, interrupting them. And then the second step is to detect or identify those individuals who are high risk and put them into case management. And then the third thing is to change social norms, which is really important. So when we look at what happened in the violent situation, so we can interrupt the situation, but as I would tell my team, we can interrupt the situation, but what does that mean for the individual beyond that time? Right. Do you really impact their longevity or their life trajectory after that just by interrupting that situation? And the answer is no. And so what we have to do is really have a comprehensive approach, and after interrupting a situation, we have to be able to connect those individuals with the services that they need. Oftentimes individuals result in violence because they don't have the resources, so they may not have funding to pay their utility bills. They may not have money to pay for rent. They may not have money for food. And so those key issues that a lot of us take for granted, those can be life or death situations for individuals. And so we really don't take that lightly when we're engaging individuals, and we make it a point to connect them to services. The one thing I'm really proud of, for the program that we implemented in the city of St. Louis, is the fact that not only were we able to to hire individuals who are justice involved,
Yes.
but we hired them and we provided them with livable wages. So oftentimes individuals will be released from jail or prison, but the wages that they receive are not even
enough.
livable.
Right.
And then they don't have, they may not receive benefits. And so I made it mandatory for any organization that implemented the program that they provide livable wages as well as full benefits. So they have medical and dental benefits just like anyone else. They also have opportunities for professional development. And that was really important for me because oftentimes we judge individuals based on their history, not giving them a fair second chance. You know, as public health, when we think about the health of the population, we know what that means for African Americans. More African Americans are incarcerated than any other population.
Sure.
And then when they're released, we don't give them a fair chance. So what does that mean for the African American community? They really aren't given an opportunity to thrive.
Yes.
And so as we think about implementing these programs, such as the violence prevention program through Cure Violence, we have to make sure that we're setting people up for success for life, not just for
short term.
a short term.
Right.
Absolutely.
Right. That is awesome. And this is a global movement.
Right. We have the program is being implemented in several countries. We have about over 60 sites in the United States. We have sites in Somalia, Honduras, in Mexico, and a lot of those sites are expanding as well. And so I'm actually looking to meet with the president of Honduras at the end of June to talk about ways that we can continue to partner, along with the representative from UNICEF who's funding some of our programs down in Honduras and Mexico.
Wow, that is just amazing. And when I look at that whole movement, it shows that it's just not a United States problem. But this is something that is global, and it also addresses poverty as being an indicator for violence as well. Because, like you said, until we address poverty, we can't just expect people to not, in a sense, do criminal behavior if there's an economic incentive to it.
Absolutely.
Yeah.
Absolutely.
So you're dealing with the social determinants. So that is amazing work, and I was reading that there needs to be a proper investment in the program as well. So if you can speak to that if that you have to invest at the level that it's given and not expect more than what you're paying for in a sense.
Absolutely. I was really fortunate to work under the leadership of Mayor Lyda Crewson, and then also partner with the Board of Aldermen, who in 2019 passed the legislation that allocated roughly $8 million for the city of St. Louis to actually start implementing evidence-based violence prevention program, in particular Cure Violence. And so that set us up for success. And so we knew that the startup costs are usually a lot higher than the cost that it requires to sustain a program, right? And so based on the model, we consulted with organizations in other cities. And so the model that I created for the city of St. Louis was, for the first year, to including those startup costs, we will provide the organizations with $750,000. That ensured they were able to conduct any renovations, select office space, rent office space, as well as provide those livable wages that individuals need. And then after the first year, we provide them with $550,000 to really sustain the program over a longer period of time. But it also requires community engagement. And so I'm grateful for being able to work with the St. Louis Mental Health Board. So Ms. Serena Muhammad and some of her team members really came up with the idea of having community advisory board. We call it a steering committee. And the steering committee consists of individuals from philanthropic organizations, academic institutions, hospital systems, civic leaders in the community. And we also include individuals from the catchment area where the program is being planted. And those individuals help relay information back to the steering committee on what's actually happening in the area. If there's any trends that they're identifying, that information is relayed back to the steering committee. And the goal for the steering committee was, one, to hold the health department accountable, as well as the mayor's office and the teams that were doing the work. And the outcome of the first year, the first full year for all the sites being up and running, was really remarkable. So we saw a 26% reduction in homicides in the city of St. Louis. And so we've seen similar trends in other jurisdictions, but to have that happen in the city of St. Louis was really remarkable. We know that this year there's a lot happening. We've had more mass shootings that have been reported on the media than we've had probably in the last few years. And so there's still a lot of work to do. We made some progress, but there's still a lot of work to do.
Yes. Well, congratulations on the success that you have had thus far with that. And what's next for Cure Violence, Mr. CEO?
So what's next is really getting the word out there. I think, although there's a lot of great work that's being done across the country and across the world through this program, there's still a lot of individuals who aren't aware of it. And so making sure that there's opportunities for us to increase awareness and just engage communities in a much more effective manner. And not just individuals who are elected officials or philanthropic organizations or Fortune 500 companies, but really talking to community. Oftentimes, we can get what we call ivory tower syndrome, where we think we know what the community needs, but the community will tell us if we listen to them. And so that's one of the approach that I use in the city of St. Louis, is just that, making sure that we create opportunities for the community to provide us with information. But then don't just give them the platform and don't listen to them. Listen to them, then let them know that you've heard them by changing your model or making any needed revisions to better meet their needs.
That is awesome. And also telling the success stories, because I've heard about the reduction in crime, but for people to know that Cure Violence has been instrumental in helping the reduction in crime. I think more of us need to hear about that. So that's why I'm so glad that you're on the show today to let people know that you're on the case. So
absolutely. I think one of the things that we also tell people is that no program is a panacea.
Yes.
So it requires the system really coming together to support the program and to implement the program, and so that it will be successful. Without the support of the mayor's office, during my tenure with the city of St. Louis, and without to have the support of the community, the support of the staff who are actually doing the work, it could have been a huge disaster for us. But I'm grateful for some of the skills that God has given me as being able to relate with people and then being able to engage people in an effective way, so that we all understand what the mission is and we can achieve the common goal.
Right, and I would say the media as well.
Absolutely.
Because I think perception plays a large part in crime in the community. When people just see, bad things happening on the news all the time, they forget that there are also good things happening, like your organization that is helping to decrease crime and helping to provide opportunities to people who are dealing with those issues.
Right, and that's really a powerful tool, because when we think about what has happened in minority communities, disinvestment, medical resources, jobs been taken, stripped from those communities. A lot of the communities having abandoned homes. Like, there's a sense of hopelessness. And so by telling those positive stories, we're able to instill some hope in communities who may have felt hopeless.
Yes. Well, it has been a pleasure to interview you today. Thank you for stopping by and just informing us about everything that you've done. And, on behalf of the community, I would like to thank you for what you have done to help the St. Louis metropolitan area, because you have done a lot. And I don't think that your story has been told of the work that you have done to help us in our community. So thank you, Dr. Echols.
My pleasure. Thank you for having me.
Sure, you're welcome.